Welcome friends, I'm Dr. Rajsree Nambudripad and today's video is all about inflammation. Inflammation has been a huge buzzword lately. So what do you think of when you hear the word inflammation? So many of my patients suffer from inflammation, which is what inspired me to make this video. In today's video, we're going to go over what are the real root causes of inflammation. We're going to discuss the far-reaching consequences of inflammation on your health, and we're going to go over natural ways to reduce inflammation in your body. We've all experienced inflammation at some point in our lives. For example, if you have pain in a joint, whether it's from arthritis, bursitis, or tendinitis, the pain you're experiencing is from inflammation. In your GI tract, inflammation can present as abdominal pain, bloating, and irregular bowel habits. Headaches and menstrual cramps are also symptoms of inflammation. If you're noticing that your weight is rising unexpectedly, that could be from inflammation. Next, the itching and pain that you experience after a mosquito bite is also inflammation. Inflammation is a natural response of our immune system to help us fight infections. For example, if you have a cold or a flu, your immune system may cause you to have a fever, congestion, or a cough, which are all symptoms of inflammation to help you fight the virus. Physical injury can also cause inflammation. For example, if you stub your toe and it gets red and swollen. In this case, immune cells like neutrophils and mast cells leak out of the blood vessels in the toe and release inflammatory mediators called cytokines. This is what causes the pain and inflammation, but it's actually your body's defense mechanism to help heal the injury. The 4 cardinal signs of inflammation are redness or rubor, pain or dolor, heat or calor, and swelling or tumor. These are the hallmark signs of inflammation, and they were first described by a Roman medical writer, Aulus Cornelius, in 1st century AD. Once again, all of this is caused by our immune system, which is trying to heal an injury. Some of you may be wondering, isn't inflammation bad for the body? Well, it depends. There's a big difference between acute inflammation and chronic inflammation. For example, when your body's immune system is fighting a bacteria or virus, or when it's healing after an insect bite. In these cases, the inflammation is short-lived, and it serves a purpose to help your body heal. In contrast, chronic inflammation can last for months to years. This type of inflammation can be really damaging to the body, and this is what we're going to focus on in today's video. Chronic inflammation is a big root cause of so many different health conditions and diseases. It can cause metabolic disorders like obesity, diabetes, and fatty liver disease. Inflammation can also cause heart disease as well as cancers. In the brain, it can cause Alzheimer's dementia, strokes, and frequent migraine headaches. Inflammation can also be a root cause of mood disorders like anxiety and depression. Inflammation can also lead to a dysregulated immune system, causing autoimmune diseases. It can also contribute to arthritis and osteoporosis. Inflammation can also cause allergies as well as asthma. The inflammation inside the body can also present externally as skin rashes, like acne, eczema, psoriasis, or rosacea. Inflammation has also been linked to chronic fatigue syndrome, fibromyalgia, hormonal imbalances, as well as infertility. So the big question is, what causes inflammation? This is crucial information for your health. Let's go over the most common root causes of inflammation. The standard American diet, also known as the SAD diet, is a big cause of inflammation because it's full of ultra-processed foods, sugar, and refined oils. Food allergies and sensitivities can also cause inflammation. For example, if you're sensitive to gluten or dairy, but you're eating bread and cheese on a regular basis, this could be contributing to inflammation. If your blood sugar is consistently elevated, or if you have insulin resistance, which is the physiology that can lead to diabetes, this can cause inflammation. One of the biggest root causes of inflammation is an unhealthy gut microbiome. If you're suffering from leaky gut or dysbiosis, which is an overgrowth of a bad bacteria or yeast in your microbiome, this can lead to systemic inflammation. Chronic infections in your body, like Lyme disease or long COVID, can also cause inflammation. Stress is another big root cause of inflammation. Exposure to toxins like cigarette smoke can cause inflammation. If you live a very sedentary lifestyle, or if you suffer from frequent insomnia, this can also cause inflammation. What's scary is that chronic inflammation can also promote aging. We call this inflammaging. So if you're eating a poor diet, you have inflammation in your gut, you're exposing yourself to toxins, you're overweight, and you're stressed out, this will definitely accelerate the aging process. Now you might be wondering, how can I test for inflammation? We can use a blood test and measure your high sensitivity C-reactive protein level, also known as the hsCRP. If your hsCRP is under 1, this means you have low inflammation, which is optimal. If your hsCRP is between 1 to 3, this means you have moderate inflammation. And if it's 3 to 10, this means you have high inflammation. An hsCRP over 10 means you have severe inflammation. It's important to be aware that if you do your blood tests when you're sick, then your hsCRP will look a lot higher. And that's caused by the acute inflammation caused by your immune system fighting off the infection. Another helpful test for inflammation is your homocysteine level. This is an inflammatory amino acid that your body has to detoxify through a process called methylation. High homocysteine has been associated with an increased risk of cardiovascular disease, which is heart attack and stroke, as well as Alzheimer's disease. So the lower the homocysteine, the better, with an ideal level being 6. Half the population has a mutation in a gene called MTHFR, which can affect methylation and is associated with higher homocysteine levels and more inflammation. Here we have my patient Kevin, whose hsCRP came back at 7.3, suggesting he had a high level of inflammation. Kevin was a 45-year-old man suffering from brain fog, frequent migraine headaches, and joint pain. The first thing we did is reviewed his diet. We went over what he was eating for breakfast, lunch, and dinner. Kevin quickly recognized that his diet could be better. When it comes to your diet, certain foods are like gasoline and will cause the inflammation to flare. In contrast, there are other foods that will extinguish the flames and reduce inflammation in the body. One of the biggest causes of inflammation in the standard American diet is refined sugar and flours. The average American consumes about 17 teaspoons of added sugar every day, which is far too much. In addition, a lot of sodas and processed foods are made with high fructose corn syrup, which are equally inflammatory. All of the foods shown here, like donuts, cupcakes, and ice cream, can spike your blood sugar rapidly, which can cause inflammation. Next, refined oils are also inflammatory, and they include vegetable oil, soy oil, canola oil, and cottonseed oil. Deep fried foods and hydrogenated oils are the worst because they contain trans fats, which are an extremely inflammatory type of fat. These are the types of oils found in fast food, restaurant foods, ultra-processed foods, as well as store-bought salad dressings. These oils increase your ratio of omega-6 to omega-3 fatty acids, which leads to more inflammation. Later on in this video, I'm going to talk about the powerful role of omega-3 fish oil in lowering inflammation in the body. Any processed food that has a long list of ingredients can cause inflammation in the body because it's loaded in chemicals, preservatives, and additives. Unfortunately, this is why a lot of the conveniently packaged foods that are consumed in this country are fueling the inflammation. Have you heard of advanced glycation end products? These are highly inflammatory compounds that are formed when sugar links to proteins or fats. Foods cooked at high temperature will have more AGEs. Let's compare a baked potato to French fries. Not only does the French fries have inflammatory oils and trans fats, it also has a hefty dose of AGEs. Advanced glycation end products can also form in your body if your blood sugar is running high. Just remember, the abbreviation is AGE, so these foods will age you. Now let's shift gears and talk about how inflammation in your gut microbiome can be a root cause of systemic inflammation. The bacteria in your gut are strongly influenced by the types of foods that you eat. If you're eating a diet high in sugar, refined oils, and processed foods, this is going to cause an overgrowth of bad bacteria or yeast in your gut, which we call dysbiosis. The dysbiosis causes inflammation in the gut, which can lead to leaky gut as well as systemic inflammation throughout your body. Let's take a closer look at how this happens. When our gut is healthy, the cells lining our intestines, called enterocytes, are bound together by tight junctions. This helps to create a healthy barrier that keeps pathogens out of our bloodstream. But if something disrupts these tight junctions, we call it leaky gut, also known as increased intestinal permeability. In leaky gut, bacteria, toxins, and food particles can readily enter our bloodstream and cause systemic inflammation. This can also confuse the immune system and lead to autoimmune diseases. To learn more about this fascinating topic, please check out my video on leaky gut as well as dysbiosis. I also have a video on autoimmune disease, where you can learn how inflammation in your gut can alter your immune system. Then I explain how to lower the inflammation and control your disease through diet and lifestyle. This brings us to the next big cause of inflammation, which is high blood sugar. There's now a worldwide epidemic of obesity, which is associated with type 2 diabetes and high blood sugar. The physiology that's causing the obesity and diabetes is called insulin resistance. Due to the visceral fat surrounding the internal organs, the body's tissues start ignoring insulin, and the pancreas responds by producing higher levels of insulin in order to control the blood sugar. Unfortunately, high insulin is inflammatory. If you're carrying excess fat, the fat cells also produce inflammatory cytokines like TNF-alpha, which also contribute to inflammation. To learn more about insulin resistance and how to reverse it through diet and lifestyle, please check out my video on this topic. Next, if you're battling inflammation, it's also important to address any stealth infections, which keep your immune system chronically activated. For example, if you're suffering from chronic sinusitis, vaginitis, or fungal infections, these need to be treated. Other examples include exposure to mold and mycotoxins, Lyme disease, which is caused by a tick bite, as well as long COVID. Next, it's important to be aware of any toxin exposure, like cigarette smoke, pollution, heavy metals, cleaning chemicals, as well as pesticides. Some people also react to implants. For example, some women react to silicone breast implants, and it causes chronic inflammation. This is sometimes referred to as breast implant illness, and these women feel much better when the implants are removed. Another possible source of inflammation is having sluggish detox pathways. So if you're struggling with constipation, if you're sedentary, if your diet's low in antioxidants, or if you don't sweat much, this could also contribute to inflammation. Finally, if you have a mutation in a gene called MTHFR, this can affect a detox pathway called methylation in every cell of your body. Unless treated, it's associated with higher homocysteine levels and more inflammation. To learn more about this condition, please watch my video on MTHFR, which stands for methyl tetrahydrofolate reductase. Now, what are some of the conventional treatment options for inflammation? The first is to apply ice to the area of pain or swelling. This can be really helpful after an acute injury or a bug bite. The second is NSAIDs, which stands for non-steroidal anti-inflammatory drugs like ibuprofen. Next, we have steroids, which can be given in many different ways. It can be given orally, topically, by inhalation, as well as by injection. And finally, we have immunosuppressive medications called biologics, which are often used to manage autoimmune diseases. Unfortunately, some of these standard treatments do carry side effects. For example, NSAIDs can cause stomach ulcers as well as leaky gut. Chronic use of steroids can cause weight gain, high blood sugar, as well as osteoporosis. And finally, biologic agents carry a small risk of serious infections as well as cancers. Now let me walk you through my natural protocol for lowering inflammation in the body. And it all begins with a diet. First, you want to eliminate all the inflammatory triggers, like refined sugar, high fructose corn syrup, artificial sweeteners, alcohol, soda and diet sodas, refined flours, processed foods, deep-fried foods, and restaurant oils. If you suffer from any type of gastrointestinal symptom or autoimmune disease, it may also be helpful to eliminate gluten and dairy, because these are the two most common food sensitivities that can cause inflammation in the gut. Avoiding gluten and dairy can also be helpful when healing leaky gut. You want your diet to be rich in whole plant foods, because these foods are rich in antioxidants, polyphenols, and fiber to keep your gut microbiome healthy. Low glycemic index fruit like apples and berries are excellent for lowering inflammation in the body. Broccoli is in the cruciferous family, and it's another big detoxifying food. Try to choose a wide variety of colorful vegetables to improve the diversity of your gut microbiome. Quality proteins to include in your diet include wild salmon, organic chicken, pasture-raised eggs, grass-fed beef, as well as lentils, beans, and seeds. Healthy sources of fats include avocados, extra virgin olive oil, nuts, and small fish, like sardines, which are a rich source of omega-3 fatty acids. Eating an arugula salad is one of my favorite ways to lower inflammation. Arugula is a small leafy green that's in the cruciferous family, so it's a big liver detoxifier. The best way to dress your salad is simply with extra virgin olive oil, lemon zest and juice, as well as salt and pepper. Lemon juice and celery juice are also excellent for lowering inflammation in the body. Another way to get more vegetables into your diet is a refreshing green smoothie. By blending together some leafy greens, a little fruit, a non-dairy beverage of your choice, as well as a protein powder, you can make a quick and delicious green smoothie. In addition to eating all these healthy foods, another way to lower inflammation in the body is through fasting. Fasting is powerful because it promotes autophagy, which is the process of self-eating where you clean up all the garbage within your cells. One popular option is intermittent fasting. This is where you eat within an 8-hour window and fast for 16 hours a day. For example, you would eat 2 meals between 10 a.m. and 6 p.m. Fasting is a powerful way to lower your insulin levels and lower inflammation in your body. To learn more about the benefits of fasting and for some practical tips, please watch my video on autophagy. Now you might be wondering, what vitamins should I take to lower inflammation? Great question. Let's go over it. One of the most important supplements for lowering inflammation is omega-3 fish oil. This has the essential fatty acids, which are EPA and DHA, and can help to lower your inflammation as well as your HSCRP on your blood work. Our omega-3 fish oil comes from anchovies, which are a small fish, and it's third-party tested to ensure it has no mercury. You can take anywhere from 1 to 3 capsules per day, and those with autoimmune diseases often benefit from taking higher doses. Next, I recommend supplementing with vitamin D3 with K2. Vitamin D3 does so many important things for our body that it's known as the longevity hormone, and it's a strong regulator of our immune system. That's why it's so important to optimize your vitamin D level and get it to 60 to 80 on your blood work. Next, I recommend methyl B complex, which is the stress and energy vitamin that can also improve your mood. Methyl B complex promotes a detox pathway in every cell of our body called methylation. This can help lower the inflammation marker called homocysteine on your blood work. Methyl B complex is especially important for those with a mutation in the MTHFR gene. Next, we have turmeric, which has natural anti-inflammatory properties. Turmeric Pro is a combination of turmeric, bromelain from pineapple, as well as the antioxidant quercetin. This combination has helped a lot of my patients who suffer from arthritis, as well as autoimmune diseases. Next, we have glutathione, which is the master antioxidant and detoxifier for every cell in our body, but especially for our liver. By promoting detox pathways, it can also help lower inflammation. Berberine is one of my favorite supplements for metabolic health. It comes from the root of the berberine plant, and it activates an enzyme called AMP kinase, which opens up insulin receptors on our cells. Remember how high blood sugar and insulin resistance are big contributors to inflammation? By taking berberine, you can improve your insulin sensitivity, regulate your blood sugar levels, and lower inflammation. Berberine has the additional benefits of having antimicrobial properties against bad bacteria and yeast in the gut microbiome. The next step in lowering inflammation is to heal the gut. Because remember, as Hippocrates once said, all disease begins in the gut. To help keep your bowels regular, you can take essential magnesium at bedtime. Our essential magnesium is a chelated magnesium that combines magnesium citrate, glycinate, and malate. Not only does it help move your bowels, but it's also great for anxiety, muscle recovery, and deep sleep. If you're struggling with any digestive symptoms like heartburn or bloating, you can take Digestive Enzyme Pro. This is a strong and effective broad-spectrum enzyme that can help you better digest proteins, fats, and carbohydrates. Improving the digestion of our food is vitally important because undigested food particles and proteins can sometimes register as foreign threats and confuse our immune system and lead to more inflammation. In order to heal inflammation in our gut, such as leaky gut, we can use L-glutamine powder or IgG GARD. L-glutamine is the amino acid food for the enterocytes that line our small intestine, and it can help seal up the tight junctions between the cells. IgG GARD is immunoglobulins that can rapidly heal gut inflammation as well as bind toxins and bad microbes in the gut. In order to restore a healthy gut microbiome, you want to colonize it with a wide variety of good bacteria. This is why taking a high-potency, broad-spectrum probiotic can be so helpful, like our probiotic 100 billion or our probiotic 225 billion. These both contain over 5 strains of lactobacillus and bifidobacterium, which are the good bacteria for our gut microbiome. Herbal antimicrobials are a powerful tool to clean out the weeds that may be growing in our gut garden. This includes berberine pro, oregano oil, and alicidin, which comes from garlic. These 3 herbs are effective at treating a wide variety of conditions, including dysbiosis, small intestine bacterial overgrowth, small intestine fungal overgrowth, as well as candida overgrowth. Additionally, they have anti-inflammatory properties. To learn more details on how to heal your gut using these herbal antimicrobials, please watch my video covering my herbal protocol for SIBO or my video on Candida and SIFO. Now let's talk about how your lifestyle habits can make a big impact on inflammation. Prioritizing sleep is of vital importance when it comes to lowering inflammation. It's also important to get to bed before 10 p.m. because your peak production of melatonin and growth hormone happen between 10 p.m. and 2 a.m. If you're not getting enough sleep, this will raise your cortisol and insulin levels, which will lead to more inflammation. Regular exercise helps promote blood circulation throughout your body. When you exercise, you're improving your insulin sensitivity and you're sweating out toxins. I recommend 30 minutes of cardiovascular exercise every day. But excessive exercise, like running a marathon, can actually increase inflammation in the body. Doing calmer exercises like yoga and stretching can also help lower inflammation. A lot of times, inflammation is being triggered by emotional stress. This is why regular meditation can be a powerful tool in lowering inflammation. Other ways to lower inflammation include getting a regular massage. Promoting lymphatic circulation by standing on a vibration plate or jumping on a trampoline can also help your detox pathways. Saunas are another great way to detoxify by sweating out toxins. Remember how ice can treat inflammation and reduce pain? This is why doing a cold plunge, which is when you immerse yourself in cold water, can help lower inflammation. It's also a positive stress on the body, which we call hormesis. An easier option for many people is to take a cold shower. Now let's return to my patient Kevin, who we met earlier in this video. Kevin did a great job of following the anti-inflammatory diet that I described today. He was also consistent with his supplements, which included the omega-3 fish oil, vitamin D, and probiotics. When I saw him 3 months later, he had lost 10 pounds and he felt so much better. He told me that his brain fog was gone and that his joint pain was also gone. His blood work showed that his hsCRP came down from 7.3 to 0.9. So his inflammation had come down significantly with this natural protocol. Let's review the key points from today's video. Chronic inflammation is a big deal because it can lead to a lot of diseases, like obesity, heart disease, and even cancer. Our diet plays a big role in our inflammation levels. Inflammation can also stem from a disrupted gut microbiome or from elevated blood sugar and insulin levels. My natural protocol for reducing inflammation begins with cleaning up your diet, taking some key supplements like omega-3 fish oil, healing your gut microbiome, and prioritizing sleep and regular exercise into your lifestyle. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. Please post all your questions and comments below. I look forward to hearing from you. Thank you again, and have a wonderful day.